Great. Well, welcome everybody. Before we talked about how Totara is such a flexible tool, and just like, and I know I'm not sharing yet, I will in a second. I just have a few opening comments so you know what's happening when I show it. Um, just like all of our clients use Totara differently, I do all of my demos differently. And I had the opportunity to learn just a little bit about your organization from Chelsea this week. And first, she kind of talked through and helped me understand the different roles that might be using the system. And then she also talked about a use case. Um, and Chelsea, I don't know if you want to jump in. I'll try and explain it, but it's sort of a pain point with your existing LMS. So it's when new nurses are orientated and there's a variety of things going on. So on Monday, they might take some micro learning. And on Wednesday, I think it is, there's an in-person where they have to be on site and they practice some skills. And then after that, there might be some scenario-based training. And then after that, there might be a live Zoom session to wrap things up. And so you have a variety of things going on. And I thought that would make a fantastic demo. So the way that I organized your demo is we're going to go, I'm going to log in one at a time in 4 different roles. So we're going to start with Anna, who's been enrolled in the new nurse program, and we're going to kind of look at what her life might look like in Totara Talent Experience platform. Then we're going to log out of Anna and we're going to log in as Jessica, her supervisor, and what kinds of things might a supervisor do to help manage their team. Then we're going to log out of Jessica. We're going to log in as Angie, and Angie's a course creator and a facilitator. I understand those might be separate roles, but we only have limited time, so she's going to share those two. And then we'll log out, and hopefully we have enough time. I'll log in as me as an admin, and we'll kind of see what it looks like from the back end as an administrator. Okay, so Chelsea, did I capture that correctly?
You sure did.
All right. And that makes a lot more fun demo, I think, when we're doing something that's meaningful to you. So right now you can see up here, I'm in as Anna Gross, a new nurse. I just chose a generic dashboard when we come in, and we'll kind of walk through this quickly, but then we're going to get into that new nurse orientation program. So like Rob said, Totara is very mobile friendly. It uses responsive themes, so it detects what kind of device you're on and makes the best look. It resizes everything for that device. And it also has a mobile app. You don't have to use the mobile app. You could just log in on your phone and it would resize. But one of the cool game changers of the mobile app is that if you're using SCORM, a learner could be at a basketball game for their kid and they could work offline and let SCORM. And then when they sync up to Wi-Fi, their work syncs up. And I have put in some SCORM in here because I know that you had some questions about SCORM reporting and so on. So when we get to, I'm already forgetting the name of the course creator. Let me get my notes up here. Angie, we're going to look at some reporting about the SCORM because you had specific questions about that. So a dashboard in Totara language is highly configurable. When Rob showed that case study of the Department of Ag, you saw how it looked so beautiful. On staff at Totara, there are graphic designers and Totara designers that will help make your vision of how these dashboards will look. And dashboards can be assigned dynamically, and people can have multiple dashboards. So Jessica might have her own learning dashboard, but she might have a supervisory one where she can see her team and how they're progressing as well. All of this are made by blocks, and I just went with a generic out of the box one today because that isn't my main purpose. But you can move these blocks around. You can have your own imagery. You can pull lots of things. So this would be a typical dashboard, and I'll just kind of walk through it quickly, and then we're going to dive into that use case because I think that's kind of the crux of where we can show a lot of the functionality that you're interested in. So you can have banners across the site. They can even be dynamic and be like a gallery view or what have you. Sometimes we've done virtual conferences and we'll have like marketing up here and you can click on things to register because the system does both live and online and blended learning and mixes that all together. We'll spend some time in the course catalog, things you've been assigned, the Engage where it's collaborative, we'll do that as well. This is the learning that she has been assigned. Some of it is, I should say, assigned, some of it she chose. And this nurse onboarding program is going to be the program that we're going to dive into and probably spend a lot of time or the majority of our time there. One thing that was so innovative in your requirements that I was happy to see is that Totara suggests learning. So this learning isn't very nursey. I didn't have any time to put nurse content, but it's looking at what's trending. The more people that participate and the more the person participates, the more it can hone in and sort of like make that Netflix experience of recommending things. It's called the recommended engine. I use it on the Totara community. I go there every day to learn about Totara and it recommends things. And that's a much bigger community than my 5 learners on my demo site. And it's really good at recommending things that I don't know about Totara or that are new that fit my status that I should know in my role. And then this can be collaborative. And so Anna is in a group and we're going to talk about that, but these resources and things that are shared, it does recommend learning for her too. Then in this particular dashboard, they chose a block of what courses she's completed, some gamification of badges. Anna's brand new, so she has no badges yet. She's just starting with the organization, but she is booked for some upcoming trainings. And some of these are in person and some are Zoom. And it's going to tell her details. She would have also gotten some notifications that tell her the address, the instructor, things like that as well. So that's at a glance what a dashboard could look like. It will be fun to imagine with you of how you want your dashboards to look. And different people can see different types of dashboards. So maybe even different departments or different roles have different needs. Okay, now in the interest of time, we're going to dive into this new nursing onboard program. And the word program is important in Totara. Programs are where you can get workflows of different learning experiences put together. So Anna is 14% done and she's got a ways to go. And so to open this up, you just click on it and it's telling her exactly what she needs to do in her first week. So I've got when it was assigned and it's due June 1st or in 9 days. She can request an extension with her supervisor should she need it, and her supervisor could say yes or no. That feature can be turned off too, but in this one, I kept it on. So she did finish the repositioning course, but she hasn't done any of the rest of her micro learning. And I set this setup so you have sets in a program that they could do it in any order, but this had to be done before she could do anything else. The next part is going to be this in-person practice. And so actually when she launches it, she'll just see that she's enrolled and where to go. It was also on her dashboard, but she doesn't have to do anything. Her trainer for that one will mark if she's present. So Angie later is going to mark her present, and there's a scale I uploaded on how well she did during that day. And then we're also going to do some competencies on that day where she can be marked competent on certain competencies if she can demonstrate she can do it there. And that's kind of where we're going to bring in the perform. Then on Thursday, she's going to do some practice scenarios. So we have some scenario-based learning up there. And then after that, she's going to do the virtual reflection in Zoom. And that was set up in both the live in-person training and the final Zoom are done with a tool that handles live events. Okay. And it's called the seminar tool. And it has a whole bunch of notifications that we'll get to if we get to the admin. And those send out things like the link or the location. It can wait list. It can have manager reservations. And you set it up system wide once, and then you don't have to touch it, but it can be overridden by Angie for her event if she has certain tweaks that she doesn't like the overarching. But usually organizations will set it up the way that they want it, and then they never have to worry about that link getting out. And it'll send an iCal invitation, and the person can click on it and it'll add it to their calendar with the link and the time and so on. Okay, I see I've got questions. How are we doing, Rob and Tracy?
Well,
Any ones I should address right now?
well, Alistair wants to know what sources are drawn from when it comes to the Totara trending recommendations.
Oh, okay. I'm not an engineer, but I do know, having set it up and trying to get it to work, we use it both internally at Totara too. So I have experience as a learner using it, and I have experience trying to do a demo site and getting it going. It doesn't get going right away. And so when you do a demo environment like this, it gets a little stressful. I had Aaron help me out and go in as some fake learners and like things and recommend things and so on. So it's looking at your profile a little bit, at your role in the organization. It's looking at what you liked before, a little bit like Netflix, like if I like this, then I might like that. It's looking at who you interact a lot. So like if this person liked this, then maybe I also would like that. It's looking at what work groups I'm in. So I'm interested in X, Y, and Z. So here's a new resource. Maybe I would like that. And it's also looking at how social that is. The more people click on it, like it, share it, rate it, the higher it goes and the more likely it is to be shared. So in a demo situation, it gets a little bit stressful because in order to populate it, we need to have a lot of people working on it before it starts bubbling up. Does that help? So it's a lot of things that are going on in the back end.
It
There
does.
is,
Yeah.
yeah,
I was curious things like if we've got med surg nurses or ED nurses as an example, will it will the platform be able to distinguish and say, well, these type of nurses are looking at this kind of content, so therefore we can draw that information in and say recommendations for people in similar jobs would be.
yeah. So there are a lot of ways to approach that. Another thing that I did for your demo, because I want this to be my next demo site, so always setting up a new demo site is hard. I did multi-tenancy for this, and I wanted a healthcare tenant just for this demo. And so what is bubbling up are some other demos that aren't in your tenant. What I did not do in my setup, and I had reasons for it because I thought we might want to be all over the platform. You can set up isolated tenants, and we do have clients doing that. And so one is this organization that has 300 school districts, and they have a tenant for the teachers, and they're sharing one kind of content. And then they have their staff that works internally, which might be accountants and programmers and things like that. So that's a separate tenant. And we used isolated tenants, and they do not see each other's resources and they don't bubble up together. So there are ways to even further restrict it. It will naturally kind of know the things you're interested in. But if you want it really separate, there are techniques to do that. Yeah, if that makes sense. Great question.
We have a couple of
Tammy?
questions
Yeah, go
from
for it.
Katie. Would they be able to attend the virtual reflection day if they don't complete the items listed before it in the program?
In my setup, no. So you get to decide the workflow. And the reason is I did a then and not like an and. And so I said you can do these in any order, but you must have this all complete to be able to eligible to go to the SIM ITL training. You have to be marked present here to do the practice scenarios. You have to finish those to be able to do the virtual reflection. Now, I didn't have to do it that way. I could do ands and ors and even make choices. Like maybe if you wanted to personalize learning, you could either do the micro learning or the in-person training or the Zoom session. So you have all these workflows with programs that can be set up in different ways. So in my rule set, you had to do it in order somewhat. You had to do the sets of training in order, and each of these in a program are called a set. Yeah.
Okay, and so then Tammy, what happens if they don't attend the in-person session?
Yeah.
What would the configuration options be there?
Yeah. So what I did in my design, and there's probably many because Totara is so flexible, is I have, let's just go to this one. Um, I use the seminar tool, and I figured if for some reason they couldn't make it, they could sign up for another one. And in my rule set, um, so I have 3 dates. If you didn't make this one, you get another chance or another chance. And I set in the rule set that if you didn't make the first one, you get one other chance to sign up for one. And then I guess as an administrator, as a, more on the human end, you're going to have to decide if that person's right for the nursing program or maybe the time isn't. But I did book some times for that person. So that's how I handled it there. There are probably other use cases and ways we could do it too. So there are many, many rules. And when we get into Angie's rule, we're going to dive into the seminar from the back end and look at all the options to configure it. And that's where it's really fun being a consultant and learning, okay, what do you want to build? And then we'll help you. And sometimes, like Rob said at the beginning, we have to look at the documentation a little and go, okay, this is how we would do it. Yeah. So every client's different, and it's very, very flexible to put together. I love Chelsea's use case of a lot of different learning types where a lot of moving parts, and then we can track this overall. We can track it individually, but then very simply overall, she's only 14% done with her orientation. And in the system, there are other ways to package learning. You can do just a course by itself. You could do a certification, which is really like a program accepted, expires, and it renews. And that can be very important in healthcare. So that CPR is going to be good for 2 years from the date I passed, and I want to re-enroll that user 3 months before it expires so we never have gaps in our certifications. The system can handle that through certifications. There's also individual learning plans where a manager and an employee, after a review with the perform, can put together a learning plan with all the things in the system. So it makes sense that it's with the LMS with goals and to minimize achievement gaps, and put a personalized plan together for the year too. So lots of ways we can take learning and package it together. I could have also added competencies to the nurse onboarding program if I wanted to as well. I didn't for today's demo, but we are going to talk about competencies too. great questions.
And
Okay.
that catches us up. So
I-
you're ready to go?
Tammy, this is Sarah. I have one other question.
Yeah, go
So
for it.
within this set of learning that the entire set has a due date. For say each micro learning that you have listed, can each of those have their own specific release date and their own due date just within the larger?
Yes, you can have the micro, like each of these could have, and you could have had one for the set as well. And those due dates can be relative or fixed. I went with relative, thinking that you might want this program to never go away. And so you might just keep adding seminar events and locations, but then the content stays the same. And I put a rule with what's called an audience. So you'll see the member of the audience nurses, and anybody in their profile that had the job of a nurse and started after May 1st went into the new nurse onboarding program. And so there are 3 people that fit so far, but if somebody was hired later and their profile came over and they were a nurse and they were hired at, a new hire, they could automatically be assigned to this. I assign them to the seminars, but they could also sign up for the date that and time for things like a Zoom or an in-person that work best for them. So I have this relative that they had 10 days from the day that they were assigned the position of nurse to finish the onboarding program. And so it would always, I wouldn't have to touch this again if I didn't want to. So that's how the power of Totara is, it's very, very automatic. You can set up a lot of automation flows so the admin doesn't have to do things or set them up once. And then we don't have to keep adding people to these programs over and over and over. And there are notifications that we'll get into with the program. And one of them that I set up, and we'll see that from the admin, is that when they're first enrolled, they can get an email and click on it from their phone. And of course, they still have to log in, but it'll take them directly here if they wanted to. Likewise, I have notifications if they're overdue. If they get too overdue, their manager gets an email I set up in my workflow. And again, I only have to do those things once. And then it's all set up. The whole system is, and I don't have to keep looking and saying who did, who didn't, who's not done. And I can also get dynamic reporting either emailed to me or embedded right into the system with the report builder that we'll get into with the scenario in a little bit. So those are kind of admin things. Great question. So due dates, yes. And also there was a notification that I chose not to do where if your set is late, and you can get reminders like micro learning is due in 1 day or things like that. And you can do that in courses too. So lots and lots of notifications. What I like about Totara is they have a notification center that's very easy to manage as an admin that shows all of the notifications in one place. So you don't have to hunt around and you can set them up system wide, and then you are golden. And then if somebody like Angie wants to override it for her particular program, she can. Yeah. Okay, great questions. You're making the demo so much more fun. Let's look at this sim day. I was talking to Chelsea and I asked her the question, like, could you have competencies, or are there certain tasks that they have to show that they're able to do, and how is that tracked? And, it might be pencil paper today, but more and more of our clients are using the perform part to do things like that for performance assessments. So Anna Gross here, she has in her profile, or there's several ways you can get to it. She can go to her competencies from Develop. It's also linked to her profile as well. So if she goes here, this is the competencies that have been assigned to her. Now, she hasn't done anything yet, which is expected. She hasn't been to the training yet. She is still working on her micro learning. She hasn't had anybody observe her yet. But as her career or her job goes, this can dynamically change, and you can have different paths for how people get the competencies. You can even have multiple achievement paths. Like you could say, if you completed your micro learning or if somebody watched you do it. For me, the competency path that I chose is they have to complete their micro learning, and at the training that's in person, the trainer, which will be Angie here, will have to or their supervisor will have to mark that where they are on a continuum of a scale that I put in here, and then that will dynamically update. And then that could be used for reviews, for putting learning plans together, for, we have reports in here for like a department and where are the gaps and where is more training needed, all kinds of use cases that we can do from here. But right away, the learner will always have access to that too. And sometimes you could self-assign competencies. I left that on. You could turn that off too. So that's another way that we could use the system. I also think I love Engage. And we're going to go to Anna's workspace. I just gave her one and she could join others. But there's a lot of research that when people are first onboarded, they need a ton of support. They need just-in-time support. They need checklists. They need a mentor. They need to know where to go for things. Maybe even you could have a creative workspace where you put in a menu of nearby lunch places to make them feel welcome on the first day. So these collaborative workspaces can be anything. I have a lot of my own, and I'm part of a lot in our organization. You can have discussions. This is the resources, and this is some of the things that are bubbling up and trending now. This library is not very nurse focused. I have to say it's more Totara focused, but we'll pretend that it actually pertains. Maybe there's a nurse onboarding group, and then you have your members, okay? And you can have people dynamically added, or they can choose to join. I have that audience that we talked about automatically joined, and they would get a notification that when they start the first day that they're part of this group. We could even make it more prominent on their dashboard if we wanted to. And hopefully you have some things to help them, or there could be frequently asked questions, things like that. When they go into a resource, this is kind of, it also, these things tie into the catalog, so they will show up and are searchable in the catalog. The person can bookmark and make playlists. So maybe there are certain resources that were really helpful to them in the orientation, and they sort of bookmark and save those into their own personal playlist. They can like them, they can share. Hashtags really help with getting it in the catalog and searchable. You can have groups comment on things. So I was working on a project where we were talking about rebranding some things, and people were putting pictures and ideas, and we were commenting on what we thought. And that's where the collaborative workspace can kind of be. And then once the engine gets going, we'll see if it is not right now, you have to have a critical mass. It sort of Netflix and says, hey, if you like this, you might like these related resources. So once the community gets going, things can really start to hop. And I think that in the onboarding process, you've got your formal compliance type things, but it's nice to welcome people and help make the onboarding more seamless, more human, more just in time, more informal. And that's where Engage can really help. Okay, let's dive into Perform a little bit. Totara also has a performance management system, and there would be alerts, and this can show up on the dashboard. It can show up in your email too. But the system, the HR department, let's say, has given Anna an appraisal, and maybe that appraisal has several parts to it. So she's been assigned a start of the year appraisal, maybe meaning the year of her first year of employment. And the HR department can set up all kinds of workflows that are trackable. And just like the programs, you only have to set it up once, or you could have all different workflows, different departments, different positions, and then it all assigns. So Anna maybe started at a different date than I did. And so it will assign her manager when they need to do a check-in or a review or a 360 and so on. And then you can put in your own tools so it looks like there's going to be looking at the year ahead and general. And so it looks like in this one, and there are all different workflows, you have to reflect and respond. And some workflows, you could have competencies where you self-rate and then your manager rates, and then that goes into that competency profile. I have one complex one that I'm working on where the manager and the manager's manager and the appraiser talk about it in the review. And then there's a final rating that goes into that. So you can set up all kinds of workflows, and then from there you can get those individual learning plans going. One final thing before we leave Anna, and maybe you'll have some questions because I want to get into the back end a little bit, is you might want to find learning for yourself, your own personal growth. Maybe you don't always want to be told this is what you have to do for compliance. Maybe you want to keep growing as an individual. So Totara has a catalog, which, like everything in Totara, is highly configurable. And you had some questions about that. So when we get to the back end, we'll talk about this. This is one layout you could have. You can have a list view. I like the tile one the best. You can decide what's going to mail merge sort of into these tiles. I picked the layout where it has a show more. And so for here, we can go here and it'll show more, and then they can self-enroll in things that you allow them to. On the side, I have all the search criteria. You wouldn't necessarily have to have all these things here. That'll be part of what we talk to you about, how you want yours set up. You also had some very interesting requirements about QR codes. So I added some here that will actually, when you scan them with your phone, will take you to the attendance log if you were the instructor of who's signed up or who is the attendee list for your upcoming in-person training. I'm not sure I put it in the right place. I wasn't sure. It could have been on a dashboard, could have been in a course, could have been in an email. Wasn't quite sure. I threw it in the catalog. Not sure if I got that right, but those types of things can be done. You also asked about scanning QR codes. That could be uploaded in the system. We have clients that have done that. So at a big event, you might go to Amazon, buy a barcode scanner. Maybe it's their ID, maybe it's a QR code or a ticket. You scan them, you get a list of who attended, and you can upload that to the attendance. And when we see Angie taking attendance, we'll see where that all happens. Okay, and then what's nice, one more thing I should say, is every learner and whoever has permissions, like her manager or the admin, can see this as well, has a record of learning, which is a transcript, which is dynamic. So this is all the learning courses that I'm involved in, but these are the competencies that I haven't started any yet, so nothing's showing yet. These are the programs that I'm in, and these are the certifications that I've been assigned. And you can also have another tab that, one thing I like about Totara is if you don't yet have something, it dynamically disappears typically. So another tab could be evidence. You can also in the system upload evidence of learning and have forms of how that's rated. That can be a form of competencies or just your profile or your portfolio or so on. So if I had done that, I'd have evidence as another one too. Okay, that was quick for Anna Learning. Questions? Otherwise, I'm going to log out of Anna and go into the supervisor.